Good day, everybody. This is Gregg Johnson, the CEO of Invoca, and we're really excited because we have Invoca Summit coming up in just a few weeks, October 20th through 22nd. And in the countdown to Invoca Summit, I'm really honored to be joined by Drew Landmeier from VITAS. Drew is the CMO, and VITAS has been a great Invoca customer and has been selected as a finalist for our Influencer of the Year award. So Drew, first and foremost, appreciate your time today. Second, congratulations. We appreciate the partnership and really excited to see all the things that you all have been doing with Invoca.
As the Chief Marketing Officer for VITAS Healthcare, which is the nation's largest hospice and palliative care provider, we have a team of over 30 marketing professionals focused on delivering education to not only patients and families, but also our customers, which are referral sources. And these are the healthcare providers that truly determine if a patient is appropriate for hospice care. So we need to make sure that we're constantly delivering high value content to both of those audiences. We are primarily a digital first organization because it's very important that we're reaching patients and families and healthcare professionals where and when they need information. And in many cases, time is of the essence when it comes to family members making a determination if a loved one, which hospice that they go with. So we have been very fortunate that we've constantly looked at different analytics, metadata, and how we can specifically target language and vernacular to those different audiences, because how they search and how they look at different hospice organizations and even the services that we provide are very different one organization to another. Being a digital first organization, truly call volume in terms of how we interact and address questions and concerns that healthcare professionals or family members have is very important to us. And we have to have and show that deep empathy, understanding, and compassion. So by using the Invoca platform, using artificial intelligence and identifying core signals, we're able to better identify what matters to these audiences. And without that, we truly would be just throwing darts in the wind. So we have developed a strategic plan to take those learnings on a regular basis and adjust the content that we're delivering. And that can even mean adjusting call scripts for our call centers. We have 3 call centers throughout the nation that operate 24/7. So it's core to who we are as an organization, to be compassionate, to place patients and families first. So again, without Invoca's assistance, we would not have that insight.
And the business that you're in, to me, is a great example of a world where, being a digital first organization, you want to give your patients and families the ability to do as much through digital as possible, but also recognizing that hospice is just a tremendously emotional decision and something where people really want to have that guidance, that reassurance that they're making the best decision for their loved ones. And for me, it's sort of an interesting interplay of how you do the right things through digital, and then how do you do the right things through that human touch to give people confidence they're making the right decision at a tremendously emotional period of their lives and at that particular point in time.
It's a good point you make, because we can't lose sight as a healthcare provider that we're caring for patients and families. And to put it into context, we're caring for over 19,000 patients and families on a daily basis throughout the country. So we have one chance. And as you indicated, family members are hungry for information to make the right decision for their loved one. And we have made it our mission for over 40 years to provide education, because education is power when it comes to the healthcare consumer, and especially at the end of life, because you're no longer a consumer. Like you said, you're trying to understand what hospice organization is truly going to provide the best level of care to my loved one. And we want to make sure that we're communicating the reasons why VITAS should be selected as that provider. We actually leaned into our partnership with Invoca early on, especially with COVID. We needed to have a better understanding of what our partners, patients, families, and even the community were concerned about when it came to COVID. And you're right, we do provide care not only in the home and long-term care environment like nursing homes and assisted living communities, but also hospitals. And whether it's a condo or an apartment, in many cases we're in several urban areas. And we needed to understand what were the questions, what were the concerns that they were asking. So we took that lessons learned or learnings from those signals. And like I said earlier, we have adjusted our call center scripts. We've even provided additional training to our representatives at those call centers in anticipation of what those concerns are. We also provided that on our website from a frequently asked questions page, and I should say pages, because that content continually evolves. And it's very important to understand that with Invoca's assistance, we have updated that content on a monthly basis to make sure we're current, because as you're well aware, the story understanding of the pandemic changes on a regular basis.
By the minute.
And we need to, exactly. And we need to make sure that we are that trusted provider, and we have our thumb on the pulse of what's going on to make sure that patients and families, our healthcare providers, as well as our own employees remain safe.
I would say one of the themes I've consistently heard from customers is this idea, you called it entrepreneurship, but it's the idea of agility and just being faster, more nimble, more creative. And I think given how extreme this situation has been, it's given us as practitioners license to try new things that we might not have had under more normal circumstances.
Completely. And I would probably have to add on to that to say that as an organization and as a department, we've had to lean into our relationships more. It's really reinvigorated our partnerships across the board, including in Invoca, because it's uncovered a number of new opportunities and skill sets and solutions that we may not have known were available to us pre-COVID. So it's provided a host of all new opportunities for us.
A huge thank you. I mean, I know your team has been tremendously busy, but as I think about the extended VITAS family of employees, you, by definition, in my mind, are the embodiment of frontline. And so really appreciate everything that your company and your fellow employees have done.
The team has presented at Invoca Summit in the past, and they participated with rave reviews. So I myself this year am looking to participate for my first time. So I'm clearly looking forward to your keynote address. Of course, Gregg.
No pressure. No pressure.
No pressure at all. and definitely Seth Godin. I've been researching him online. I've been becoming a lot more active on social media myself, given COVID. So I'm truly looking forward to participating myself and getting more involved. And like I said, that's how we've been interacting with most of our vendors, and Invoca is no different. We're very fortunate to have you as a partner, and we look forward to participating even more in the future with Summit.
Well, Drew, thank you for your time today. Thank you for the partnership. It's truly been a pleasure working with the VITAS organization. And I always love working with companies that I'm personally impressed with. And I think my esteem and regard for you all as a brand, as a team, as an organization has only gone up, and seeing some of the things that VITAS has done over the past 6 to 9 months for your employees, for the patients and the families that you care for. So a huge commendation and congratulations on that front.
Thank you very much, and have a wonderful summit.